thanks for being here. We're at number 11 this week, and we are at the Getaway in Bridge Park on North High Street. So I want to thank them for hosting us with lovely cocktails,
Cheers.
which we've had a few. Cheers prior to starting, because I started with losing my iPhone, so I've been running around Bridge Park trying to find it. It was in the Condado bathroom. So there we go, problem solved. And it took me a while to remember how to retrace my steps. But we are here to talk about lasers, mainly, and cosmetic tattooing and paramedical tattooing, which we will get to. So I'm so excited to have everybody. Yeah. I have my first podcast without Dr. Weston, which is really weird, but we're talking lasers, so we're going to get down and dirty on it. As far as all of my lovely guests, we have Stacy, who's our resident physician's assistant and our provider of all things aesthetics, filler, Botox, lasers, you name it. We have Andy, who's our medical esthetician and our amazing cosmetic tattoo artist. And you are at Lewis Center full-time, correct? Yep. Stacy, you rotate between our Lewis Center location in Dublin. And then we have Adrian, our NP at Dublin and Lewis Center. Also all things aesthetics, lasers, Botox, filler guru. So thanks for being here. I'm excited. We are teeing this up because we're having a major laser event coming up in September. September 25th at our Dublin location here on North High Street in Bridge Park. 5:30 to 7:30, I believe. And then at our Lewis Center location at Evans Farms on Saturday, the 27th, from 11 to 3, I'm pretty sure. It's a Saturday.
Yep.
So everybody check out more information on our social media, on our website. We will be posting a lot about it, but you should not miss it. You are going to have massive savings when you come in person. I mean, ranging anywhere from like $1,500 up to like possibly $3,000-$4,000 with the types of packages that you can buy. So it's pretty cool. Yep. So I always like to ask, well, I want to ask, I don't always like to ask it. It's not like it's number one, but I want to ask. I'll start with Adrian. Like, what do you love most about what you do?
So it's kind of twofold. I love that every day is a little bit different, that I can walk in and not exactly know what I'm going to be dealing with. And so I can kind of pivot throughout the day. And I also really, really love connecting with people. I left bedside nursing because I wanted more time with people and get to hear their stories and whatnot. So that interpersonal connection, like I always say, I care more about my patients than they care about themselves. That's super important to me, so I love that.
I love that. Andy?
Just asking what I love.
Yeah, what do you love most about? Like when you come into work every day, like what do you love the most?
Yeah, I love that I get to make people feel confident all the time. It's one of the best parts. I think all of us could say that for what we do. Just being able to help someone find or feel their best and feel confident in the morning, no matter what that looks like for them, what their lifestyle is. But just giving them that little boost is very rewarding. Yeah.
Stace?
I'm going to throw something in for you. I think you're super creative, and I think you've finally found a niche that is super, allows that outlet for you.
100%, yeah.
And so we've seen you like grow with your cosmetic tattooing, and you just have this super creative, brilliant mind about that. And I love that for you. It's definitely where you shine.
Agree. I love watching you.
Yeah. It's like, you know, watching like
I
don't want to say paint drying because like, but I'm not as creative as
artist. Like it's
just,
it's incredible.
Thank you guys. Yeah,
I do. I totally agree. I can remember like coming in all the time. I'm not at Lewis Center as much, but at Dublin, you would always be in there and you'd be like doing different things and trying different techniques. And I love how like passionate you are about it and how you post so much about it. Yeah. It's really cool to say.
Thank you guys.
Yeah. So as far as like focusing on lasers, because we're kind of gonna start there and we're gonna like segue into some other things, but lasers, so they're huge and they're everybody loves them. We love them. There's so much they can do. There's so many different lasers. There's so many different things they can correct. So when you guys see patients come in, like what are their biggest complaints where you say you should do a laser? Like what are the concerns that patients have that would make them good candidates for that?
Well, everybody should do some form of a laser.
Any age?
Any age.
20s?
Any age. The market right now is so flooded with different devices, you can't even keep up. And technology keeps getting better and better. But there is a laser, there is a treatment out there for you, no matter your ethnicity, your age, male, female. Everybody should be doing something if they're interested in anti-aging.
What so let's talk about what we offer at our offices. What are our lasers, and like what are they specifically good for treating?
So we have kind of the gamut. So we'll start. So lasers are light emitting devices. So that's a little tricky sometimes for people because we'll get feedback from patients where they're like, "Oh, is this a laser or is that a laser?" No, light emitting devices. So BBL, which stands for broadband light, is meant to target pigment. So reds and browns. So if you have sunspots or vessels, rosacea, something like that, great for that. Then we have the MOXI, which is a non-ablative laser, and it is great for pigment. It's great for enhancing a superficial glow. It might not necessarily be great for tightening, but it's really good for younger skin or skin that isn't great for treatments that are going to increase the problems with melasma. So it's wonderful for pigment, and it works on all skin types. Then we have the Halo. Halo is both a hybrid, it's a hybrid fractional and non-fractional laser, so both non-ablative and ablative, and it's going to help with fine lines and wrinkles, pore size. It can help with some skin tightening. I wouldn't necessarily market it for skin tightening, but we have seen really great benefits from it. The whole idea behind any of these ablative lasers is to create a little bit of a controlled injury because we know how your body's going to respond. We know that it's going to create new collagen, and increase that collagen framework, and that's really going to help stimulate skin turnover and make you look younger. And then obviously pulling that pigment off of anybody is going to be helpful. So right now from a laser standpoint, what we're offering is anything from intense pulse light or the BBL all the way up to an ablative laser like the Halo.
Okay. You mentioned MOXI's non-ablative.
Correct.
Okay, explain that a little bit. I didn't realize that. So explain that a little bit, and then how does that work differently than the Halo?
So non-ablative is going to be, it's not going to actually
Disrupt
destroy
the surface.
any tissue.
Okay.
It's not going to destroy any tissue, but it is coagulative. So the heat factors in that actually, it's hot enough that the tissue is going to firm up, and it's also going to stimulate the cells that hold too much pigment to let it go. So it does help at more of a surface level than some of the ablative lasers, which cut a little bit deeper. But because MOXI is non-ablative, the downtime and turnaround time is a little bit less.
Okay. So go through states like Halo, BBL, MOXI. What is the downtime for each of those?
So Halo, I'm thinking of Claire.
Yeah.
Or
Chandra.
Yeah.
So
Or Kelly. Kelly's another one
and
that
I will
goes
tell
up.
you, like, your first Halo may not be like your third Halo, right?
Fair.
Right?
100%.
So, and it's
Unless you're Claire and Chandra.
and Chandra. So there are exceptions to every rule. But I will say Halo, you plan on like 5 to 7 days, right? You have swelling, you have redness, you feel like you're on the surface of the sun for like 6 hours. We have things to help with that, and we can get into that later. And then you kind of get this sandpapery texture that you can't hide. Like, you put makeup on it, looks worse. Like, don't even try.
You can wear makeup. It just looks like you're wearing makeup over
It
sandpaper.
looks like you put makeup on sandpaper.
Yeah.
Right. And then, it flakes off. It's so satisfying. But you come in for your post-Halo facial, you walk out, and you are like,
A new human. Baby deer.
It feels like
Baby
it feels
deer.
like
what is
snake
that like
skin.
to do that? Like, honestly, a post-Halo facial
It's
for
crazy.
somebody?
Yeah, it's fabulous because you'll have like a little bit of the mens left at that point.
Yes.
It's 7 to 10 days after your Halo. So we come in and do just like a good gentle enzyme exfoliant, and that just helps to lift up any of those remaining mens that are on there. And like I said, you're walking out like a baby seal. Like, you're finally like feeling like yourself again, or back to your normal but glowier.
And that's like 7
a
to
week
10
later.
days.
Yep.
Dry and itchy.
Yeah.
Dry and
Yeah.
itchy.
Yeah.
Dry, flaky, itchy.
Totally worth it.
1,000,000%.
It's kind of like childbirth. Like
Yeah.
I tell my patients, do it every year, not childbirth.
But way easier.
Not childbirth, but like do it every year and like you'll forget, but you'll remember your post halo
Yeah.
glow.
Yeah.
You will remember that.
Yeah.
So that's halo. BBL, really no downtime.
No
Some
downtime.
people get a little bit of swelling, especially like maybe in your tear trough or something. But you can wear sunscreen, look normal, no downtime. The MOXI, it depends. So the thing I love about the MOXI is you can make the MOXI like a halo, kind of, honestly. Like if you do a heavy 3 to maybe 4, as you and I both do, you can have the same sandpaper 5-day kind of texture issues. Or you can do a level 1, you can do a level 2 that's safe for all skin types. And you really may not have that much, you know, but it's still doing something. A week later, your patients come back and they're like, oh my gosh, I totally notice a difference. Hyperpigmentation, even in ethnic people or higher on the Fitzpatrick scale, they're coming back and saying, wow, I notice my face got brighter, which is awesome.
I think that's super important actually to note is that we didn't have for a long time the option of treating people with a higher Fitzpatrick. When we talk about Fitzpatrick, there is an algorithm that decides which Fitzpatrick you are 1 through 6. So it is your ethnic background, your eye color, hair color, skin color, all those things. And it basically goes from less melanin to more melanin. It's essentially what it is. So for a long time, we didn't have a laser or any light-based therapy that could treat a higher Fitzpatrick because the chromophore is melanin. It looks for pigment. The laser looks for pigment. But with the MOXI, we are able to actually treat people that are a higher Fitzpatrick who maintain more melanin and get a really beautiful result, which for us has been incredible.
Yeah.
For these
It's a
people
game
that-
changer,
It's a game
for
changer.
sure.
You know, it gives them the result that they're looking for without the concern that they're going to have, you know, side effects.
So who would not be a candidate for like a halo, a BBL, or a MOXI? Anyone?
You're a candidate for one of those-ish,
Always.
always.
So one of them.
Yeah.
Maybe
Okay.
not all of them,
Mm-hmm.
but you can safely perform one of those for at least any skin type.
Awesome. What, as far as like what prep work goes into, like, if say I want to schedule one? So what would you guys tell me, like, hey, before you come in, you need to make sure this, this, and this you're doing prior to like coming in to see us? Is there anything any rules around?
Medical grade skincare. I mean, Andy, how many patients do I pull you in
A million.
at Lewis Center? And I'm
Yeah.
like, listen, maybe this patient, if you're like a Fitzpatrick 5 or 6, you have a darker skin type, you have more melanin in your skin, you need to start hydroquinone or something, a pigment regulator, even intensive, something. You stay on that for 1 month, you come in, you do your laser treatment. It really, really helps with the safety and the efficacy of the treatment in and of itself. So I would say most important thing before you do any intervention is to start good medical grade skincare.
Yeah.
Agree. And I also will say that because, and I'm going to use the word chromophore again, which is just essentially the part of the
Science
molecule.
nerd.
I know, the part of the molecule that determines the pigment. That's what these lasers work for, and it's what the different wavelengths of the lasers look for. So we, as providers, will choose that for you to get you the result you want. The chromophore determines the outcome. So if you are somebody who isn't following our pre-instructions, who comes to us super tan or anything like that, your outcome is going to be significantly different. So sun exposure is very important. Your skincare ahead of time is very important. A pigment suppressor, like she was talking about, is very important. Sunscreen is very important. There are things that you can do to set yourself up for success ahead of time. There are some products that we can recommend that essentially feed your skin ahead of time so that it's healthiest and it will heal faster and better ahead of time. So all very, very important. Your outcome really depends on what prep work you do put into it. And when you come to us, we'll do a consultation. We'll tell you all of that. Every laser should have a consultation ahead of time.
Yeah.
It's funny you mentioned that because I have one particular patient and I love her, but she's like, she just felt like I was trying to upsell her, like it was a money grab. And I was like, I looked her dead in the eyes and I was like, I will not do your laser if you do not start these products.
100%.
And she was like, oh.
Oh, it's that serious.
I'm like, I mean what I say. Like,
Yeah.
this is not a money grab. I really want to help you. And I know the key to your success.
Yeah.
It's a whole treatment plan.
Yeah.
It's not just a one and done thing.
Yeah.
How long should you be out of the sun prior to a laser and after a laser?
Forever.
Ever. Ever.
Realistically, hence the girl who just got back from
Biggest
Florida.
I know. This is fake. We tell you 2 weeks, but that's ideally you are not tan. You're at your base. Hey, listen, it's your money. You can spend it however you want.
Yeah.
But ideally your base
Yeah.
color, because if you have any pigment in your skin, which again, chromophore is endogenous or exogenous, like if you have exogenous color and you bring that in, then that's going to be your result too. Like it's going to be minimized. We're not going to be able to treat you as heavily because we could cause more
Damn.
side effects that you don't want.
Yeah. And that includes like self tanner too, right? You can't use
Absolutely.
that prior to your
100%.
procedure. How long no self tanner? Just
At least
until
2
you
weeks.
just look like
Until
your normal
you're
color.
base
You're
color.
not orange anymore.
And you can walk in and tell.
Yeah.
She's like, you know, you have these patients. Oh, I'm really good with sunscreen. Really?
Or they'll be like, I haven't been in the sun. I'm like, cool, let me see your stomach right now.
Yeah.
Lift
Let me
your
see your
shirt
butt
up.
cheek.
Lift your shirt up.
What did you say?
Let me see your butt cheek.
It's a real
But it's
tell-all.
true. I need to see your base color
Yeah.
because I need
I just
to
looked
know.
at someone's last week for the same reason.
Oh my gosh. You would never do a laser on me if you looked at my butt cheek.
I would never do a
Never
laser on
seen
you
this
right
guy.
now.
I know.
Yeah.
It's why we don't do BBL on you.
You do, but
Halo only for Carrie.
you did a BBL on me not that long ago. It worked so well.
Well, were you this color?
No.
Okay.
Well, I would never do
Weird.
this color.
We would never do it.
I would never do this color. And I'm just giving a PSA and I'm looking at the camera. Totally mine. You guys can disagree. But I will tell you that you're going to pay the same amount for your laser. So you might as well crank that stuff up because you might as well get the most bang for your buck. And I tell everybody that. I'm like, go hard or go home.
Yeah.
Like, you're going to pay the money.
Yeah.
Get the best result. Be as aggressive as you can be. I mean,
And
it's
we're
just-
results driven.
Yeah.
We are.
Yeah. But you're also realistic and you're
We
not
will
like,
crank it
you're
up.
not like
Yeah.
cowboys out
We are-
there.
yeah.
You
We
know?
are. We're very
Yeah.
results driven. I think we actually touched on this in a previous podcast. Was we talked about it's not the wand, it's the wizard. We have the same device as everyone else, you know,
Yeah.
and we can
It's very
customize
true.
your treatment. If
Yeah.
you say, "Hey, I've got to be at a wedding in 2 weeks," we're gonna back off. We're gonna
Right.
we're gonna give you a pretty glow. You're gonna look great. But if you're like, I really don't like my fine lines and wrinkles, then what I'm choosing for you, the settings I'm choosing for you, are going to be entirely different. And you do pay the same for all of it. So I would love for you to plan enough time
So
to
take
recover
advantage
and
of it.
heal, you know,
Yes.
appropriately, so that I can give you what you really
Yeah.
want.
100%.
I want you to blow my face off.
Literally.
Yeah. Oh yeah. Cook me, microwave
Yeah.
me.
Do
Well,
it.
that's
Take
the
me down
same.
to
Do what needs to be done.
Same reason, like speaking of like you're gonna pay the same regardless, but especially with like the pre and post care, we'll always tell people, especially when you pull me into those consults, I'm like, I'm not like we're trying to protect your investment here. Like
Yeah.
if you're just coming in once a year to do these treatments and you're not doing anything else, just throw your money out the window on the highway. Like
Don't
it's
do it.
Literally.
Like if you're not going to do the
Yeah,
good
and
skincare,
like
the
you
sunscreen,
said
don't
about the
waste your money.
skincare stuff, I've literally told patients, if you left without this, I would not do the treatment on you. Like it's that serious, truly
Yeah.
is.
Yeah, agree. And I feel the same way. I have always said, I think I've been here 8 years, and I know we get a lot of nice perks, you know, working here because they want us to try everything and experience it so we can talk about it, which I think is great. But I always say, if I didn't work here, like Halo BBL, I would fork out money
Yes,
every year
every
for
year.
it.
100%.
Because the results are amazing. It's worth every penny, and you just feel so good afterwards. Like when that stuff's coming off, and you just feel it's like a baby.
Yeah.
You're just like, oh my gosh, this feels so good.
Important to note, you look amazing 2 weeks later, but that's that 2 to 3 month later when
Yeah.
all that cell turnover has happened, that collagen reproduction has happened, and it builds on itself for up to 12
You have, a
months.
new
Over time.
you have a new face.
I'm
Yeah.
telling you,
You legit
it
have a new
works for
face.
up
I
to
mean-
12 months.
Yeah.
Like,
don't disclose too much, but I found an old
I can't wait.
found an old passport photo of mine.
Holy moly.
And
For real.
I
Same thing.
had a new passport photo of mine, and my previous passport photo was before I started working at Donaldson. And started seeing Adrienne, because Adrienne was there before I was there, so I've been seeing her the longest, and God love her, she's done it all. I mean, we've done what we've done, all therapy.
Market research.
We've done Morpheus, we've done Halo BBL, we've done, you name it. I've been the guinea pig for it all, and I love it, and she's amazing. But I literally sent my old passport photo, which was old. Like, it was a solid 10 plus years ago.
They're good for 10
And I
years.
sent my new one, and I was like, like,
I remember it.
I know,
was
you're like, what?
It's shocking.
It's
It felt like
shocking.
you were in witness protection.
I'm telling you,
You're a double
it
take.
was bad. And I was like,
government
I go,
protection.
if I should show it and say, this is what.
It wasn't
should.
bad.
We'll insert a
No,
clip.
it's so bad. It's so bad.
Guys, come into the office.
But it's literally,
we have
It's
it.
our first
It's
before and after.
It is our first public
It's
before and after.
crazy because you don't realize it. But over time, as you're slowly doing these things
Yeah.
for 8
Yep.
years,
Yes.
it's like, oh my gosh, it's crazy. You could, I look sunken and sallow and like dull.
Well,
And
studies show,
now
like
it's
in your
like-
40s,
Oh.
it's like down
34,
the shitter.
yeah,
man.
it's down
Yeah,
the shitter.
35
Not
to
for men
45.
though. Men 60s.
Yeah.
I know,
Or
they get
40s.
hotter.
Yeah, screw
But I
them.
think
Don't
it's
worry,
important
we had the
that
kids.
it's over time. Like, we didn't
Yeah.
do all of that at
No,
once.
you have
It's
to be
not like-
consistent.
Yeah.
Yeah. It was
And
a
it's
little
the daily
things
skincare too.
over time,
100%.
and it was. And
Yeah.
that's, I love that you keep bringing up the skincare part of it, because it's so important. And I feel like people are so willing to cut that out when they're at the end of the day, they're like, oh, I don't want to spend it on
Yeah,
that.
100%.
no.
But it's like,
Yeah.
it's a recipe.
So
So if you leave out a few ingredients,
It's
it
a
doesn't
different-
taste as
Yeah,
good.
don't
No.
Like,
don't not put the sour cream in.
Right, like it's a whole recipe. So
It
if
is.
you don't include everything, like our recommendations are not because we care about. I don't know what you.
We're
have in
not
your
on
wallet.
commission.
I don't know what you have in your wallet.
Right.
Like
I'm just looking out for you.
I'm
or
just
doing
telling
what
you
you
what
want.
I think is best, and it's up to you. Again, at the end of the day, what you want to do.
Yeah.
But if you're not achieving everything that you want to, there might be.
There's
What did you leave
usually-
out?
Exactly.
Well, it's kind of like, think about a workout routine.
Yeah.
All right, let's think about it. You want to go and do an all-day boot camp one day. That's your halo for $1,500.
Who wants to do
and
an
you
all-day
go do
boot
it
camp?
all day. Well, I'm just saying, you go do one all-day boot camp for the whole year.
Okay.
And that's all you do.
Oh, got
But
it.
you're not doing daily
Now I get it.
exercise. You're not going to see any results.
Well,
When you're
yeah.
doing your daily exercise and then you're adding in like those bigger
Yep.
treatments every now and then, you're going to like have consistency show feeds results.
Well,
I
that's
mean,
the 80-20
anything.
rule. And
Yeah.
I talk about this with patients almost daily, that the same thing with the dentist, same thing with your physical health, working out, all of that. You cannot do like those big treatments
Yeah.
and nothing else
Yeah.
and expect anything to be different.
100%.
Really though. And going back to protecting your investment, it's just a waste of money, or you're throwing that out the
Complete waste
door,
of money.
like going to the gym and eating a whole cake afterwards.
yeah.
I mean,
Why did you look
Well,
at
I
me?
mean,
Why'd you look at me?
because we probably would both do that together.
I would do it too. Stacey would too.
Not a cake, maybe
Oh,
fries.
gluten-free cake.
Yeah.
Some good gluten-free box.
You're
cake,
savory. That's right.
Yeah,
You're
I'm
a
savory.
girl.
I'm a
So
salty
you would
girl.
do like
Some
nachos.
fries would be good.
Yes.
Yeah. Not with sour cream.
Don't leave out the sour cream.
Don't forget the sour cream. What am I missing here? So we talked about all the different modalities. We talked about
Let's
go ahead. You want to say something?
Yeah, I do.
Yeah.
Let's talk about add-ons that we can do to the laser
Yes.
that
let's
are
talk.
game changers, because
love it.
this is like, I feel like revolutionary for us as providers as far as pushing the limits. We like to literally blow your face off, but we want to like be respectful of your own downtime.
Yeah.
And so, Adrienne, talk about the new things that we're offering for our patients.
So, number one is going to be our RE-Essence. And RE-Essence is a product that combines an HA or hyaluronic acid serum with PDGF or platelet-derived growth factor. After we interrupt the skin surface with any of our modalities, application of this product actually has shown to increase healing speed by half is what we're
Yeah.
anecdotally seeing. The growth factor stimulates the healing cascade significantly faster. Personally, I have used it after a halo that was very aggressive, and where I would have normally had hours of burning and discomfort afterwards, 45 minutes later, I was totally fine.
Yeah, that's great.
We're
Which is
seeing it
crazy for a halo.
Which is crazy for halo. So for microneedling, for halo, for anything that we're doing, Morpheus, anything we're doing, we're actually interrupting the skin surface, game changer. And honestly, we know that regenerative medicine is the next wave of aesthetics.
Yeah.
You know, it's not about creating something you didn't already have. It's about replacing what you did. And that's really what we're doing with these products. We are utilizing them in some off-label manners that we're just utilizing the PDGF portion that we can kind of dip into. But as an adjunct to the laser treatments, if you're not adding RE essence to it, you're signing up for a lot more discomfort, and you're going to get a B+ result. We can give you an A+ result if you utilize this product. It has been an absolutely integral part of the next wave of aesthetics, and it's a game changer.
Yeah. I don't know about you, but before I will like do a halo, I just did one yesterday, and I thought, God bless you, it's August 20th.
Yeah, right,
First of
for
all,
sure.
You're going to feel real hot and steamy today. But I just said, what's your downtime like? What's your commitment like?
Yeah.
If you tell me that you're going to buy PDGF and you want that on after the laser, I'm going to crank that up.
Yeah.
I'm going to really push the limits, because I mean, the science is there, the studies are there. It's amazing.
So how
It's a game
does it
changer.
work exactly? Like, I get it helps with, like, it makes you not feel as hot, or it helps with like that piece of it. How does it give you a better result? Like from the
PDGF is actually, so it's a sterile recombinant derivative of a human-derived platelet. And actually it's brewed a lot like beer. They used yeast to brew it the same as they do beer. And it stimulates your body's healing cascade. So there are a number of chemical messengers that go out when your body has sustained an injury that start a healing cascade. So it limits inflammation. They're, again, chemical messengers that go out. It limits the inflammation, and it stimulates that healing process faster. So whereas you might have 2 to 3 days of redness and swelling and whatnot, you're cut down to 12 hours, maybe 24.
New blood flow, new nerve endings,
Yeah,
like
it-
all the
it
good.
creates-
It's like a first responder.
Angiogenesis.
So it's like, come
which is-
help, come help. There's an injury here.
The product RE Essence is the 4th indication. There are 3 others that are utilized and have been for years. One of them is bone growth that is used in dental work, ortho and joints,
Diabetic.
Oral surgery.
or no, the last one is diabetic wound healing.
Yeah.
And if you are in the medical field or know anybody that has ever suffered from a diabetic wound, it's incredibly difficult to heal that. And that really, for us, was our like, okay.
No, yeah.
They were showing us before and afters of diabetic healing. We're like, no way, no way.
Saving like amputation.
Yeah.
of limbs.
It was-
I remember you showing me these actually.
Yeah.
Yeah, that was
Yeah.
incredible.
Well-
Now that you bring that up.
Yeah, and now we all now have personal stories where we've utilized it for people and patients that are important to us that have had great outcomes, and personally too, like have had great outcomes. And again, with the services that we offer, if I can offer you a really aggressive treatment and you can turn around and only have a couple of days of downtime, okay.
Heck yeah.
Sign me up.
Yep.
I love it. So if somebody comes in for a consultation for like laser, like what does that look like? Like what would they expect when they walk into our office? Like for the whole process, a consult to a
Treating.
facial.
Yeah.
At the
Yeah.
end.
So I think what sets us apart is our team approach, truly, at our office. And I referenced this earlier when I said I pull Andy in for skincare, I pull Nikki in, I pull Tatiana in. Because you guys are the skin experts. Just like when you go to the Cleveland Clinic or you go to Ohio State, you have the bone guy, you have the skin guy, you have the heart guy, you know. And so we have that built in here at Donaldson, which I think is incredibly unique.
Yes.
And I didn't get to answer earlier, but what I love, I would say now
Did I skip you? Seriously?
Well, I talked about Andy.
Oh.
But what I would say,
That's
like
on
20
you.
years into this,
I noticed.
I did too, but
yeah, you're still a really good hostess.
Sorry. I'll just.
But what I love now is working in an environment where there's a team. Like,
yeah, we're very collaborative.
Yeah.
It's great.
and it's amazing.
Agree.
And you know who benefits the most?
The patient.
patient.
Yeah, our patients.
And they feel it. They love it. Like I just did it today with a surgery patient. I had Sarah in there, and we'll grab
Yes.
whoever one of you guys if they want this, and it's
Yeah.
just really incredible. And we'll show them all these different avenues they can take to kind
Yeah.
of get the result they want based on the downtime they have.
Yeah.
I just had a lady in who has a wedding, and she's working around a shower and a wedding, and so we were trying to problem solve when she should do surgery versus Halo BBL versus microneedling and a peel. Like we were kind of doing all that, and I pulled Sarah in because I'm, more surgery than anything else, and it was awesome. And the patient was like, "This was amazing!" Like she was so confused, and then she's like, she knew her plan. She walked out like so excited,
Yeah.
and it was just nice to just have answers and somebody kind of telling her what to do. That's what she wanted.
Yeah.
Like just tell me what to do.
Yeah.
Which I really like.
So you'll come in, you'll, meet with our aesthetic coordinator, typically if you're coming in for a non-surgical
Who's Sarah?
consultation.
Who's
Who's Sarah?
wonderful.
Yes.
She's amazing.
She says stunning a lot, which I love.
Probably the most unique person I've ever met.
Yeah.
Seriously,
Yeah.
in my
A
entire
million
life.
percent.
In
Girl.
so many
In
different
such
ways.
a great way.
In the best way
In the
possible.
best
Yeah.
way.
Intelligent and funny, and you don't even realize that you've been Sarah'd.
Yes.
It's all done.
When she's gone and
Yeah.
And then you're like, wait a minute, what just happened?
Something's
and
different.
hilarious. The
Yeah.
stories, yeah.
So anyway, she'll take you back. She makes you feel super comfortable. We take photos. I know people hate photos. It's
So do
super
we.
duper
have
important.
But they're so good. Hence my passport photo.
Yes.
Who would have known?
Yes.
I know.
You have to
And
have
like you don't know where you came from until
Yeah.
you see it.
Yep.
So photos are part of that. She kind of checks you in, feel the vibe. What are you looking for? She's so good with skincare as well. So she kind of can be that go-between with the provider and help kind of the patient navigate the whole situation, right? Because it can be overwhelming. Like we're like, you need to do this. And if
Yeah.
you're not familiar with it, it's overwhelming.
Yeah.
So she does a great job with helping patients with that. Next, a wonderful provider will come in, obviously.
Who would not be?
We'll talk about, I usually leave it super open-ended, right? Like you're here for a reason, you tell me. And then that ends on a treatment plan, and comprehensive treatment plans we love, right? Overwhelming again, but it's going to pull in different providers. It's going to pull in skin. It's going to pull in surgery, maybe. It's going to pull in non-surgical. It may be another provider, and that's what I love. Like, hey, I think Adrienne does this better than I do. I'm going to send you to Adrienne
Yeah.
because I think that's what's best for you.
Yeah.
So egos aside, we work as a team, and that's what I think makes us super unique. And
I think we're just full
100%.
of badasses, and another like PSA to everybody from somebody who, is in her 50s, and I just started working here 8 years ago. So I was very uneducated about any of this stuff, as most people are, right?
Yeah.
And I would go wherever and just thought everyone was qualified to do these things. And it's really
Stand up and get
Yeah.
on my
Cheers.
soapbox.
I know, but it's so
sultry.
scary. It is so scary knowing what I know now and thinking of what I did prior to just blindly trust. And it's even worse now because years ago, there wasn't 8 on every block,
That's
you
true.
know, and every Tom, Dick, and Harry's shooting Botox in people's face and lasering things and doing in-office surgeries on people, and you're just like, what are these credentials? Like, who's doing this stuff? And I've witnessed people be harmed by these things in a terrible way, and because these people had no idea what they were doing, and they just blindly trust. So do your due diligence, everyone out there, and just make sure you have experienced providers that are credentialed properly, that ask difficult questions, that you know what they're talking about.
I love that when someone
Yeah.
comes in and they come in with a notebook.
Yeah.
And you're like, let's go.
You're like, let's go.
I love it.
What you
I
got?
actually love it.
I love
want
it.
you to be an educated patient.
Yeah.
You're like,
Yeah.
I'm so sorry for asking questions. I said, you should ask
Yes.
questions.
This is
You
your
should.
face.
This is
Yeah.
your face.
And things can go wrong, and I think people don't think
For
that.
sure.
Or they'll come
Yeah.
in
Yeah.
and say, well, I saw it on TikTok. And I'm like, cool. Everyone's an expert.
Yeah.
Yeah.
That it drives me nuts. Like
Yeah.
everyone's an expert. There's no, you know this. There's no credentialing. There's no continuing education. There's no requirement to call yourself a master injector or an aesthetic injector or a laser specialist. There's nothing. You can just call yourself whatever you want.
I know.
Really.
My
Ask me
hope
questions.
is with like the shift in regenerative medicine that there's gonna be a credentialing body for
Yeah.
med spa. There has
There
to
has to be, yeah.
It's got to go in that direction, and I'm here for it.
Yeah, me too. Absolutely. There
love that.
should be more. I hate to use the word regulation because that goes against every fiber of my moral being. But
I don't know.
We all
Adrian.
like rules.
Let's get a police
We all
badge.
heard
Let's
that.
go.
I hate to say regulation, but there needs to be a tighter grip on who is able to provide the information to these patients because, again, you go in and you're only getting the information that that person is able to provide,
Yeah.
but no one's checking them. So come in, ask questions, come with a notebook.
Yeah.
Let's see what I don't know.
Yeah.
Let's see what question you have that I don't know.
Yeah. I love that. And I think people should ask questions and not be afraid to. And if any provider gets insulted by that, then they're not your provider because they should
Exactly.
respect
100%.
that you
Correct.
are inquisitive. They're
Yeah.
doing things to your face. They can do harm. And they should be very open to that. And if somebody's not, then walk out. Like,
Yeah.
that's the way I feel.
Yeah.
I know we all love microneedling, and I want Auntie to talk a little bit about it because I know she's educated on it too. So lasers and microneedling, I know they're similar in a way.
Yeah.
So kind of explain the differences and like the benefits you think one versus the
One
other,
or
like
another.
what you've seen.
Yeah. So microneedling. Let me put this down. Talk with my
Oh, we're
Both
gonna get a
hands.
demo, like hands.
No, I just when
Hands.
I like
Why don't you just
describe.
microneedle me? And
Well, I'm glad you asked.
here's my skin
In my
pad.
pocket.
Yeah, keep it with me all the time. Microneedling and lasers are just different modalities, but they can do some similar things. Where microneedling, what it does might be more similar to the semi-ablative side of Halo, where we are actually we're puncturing the skin, creating wounds in the skin, which signals that wound healing response, stimulates that collagen and elastin production. But it's really fabulous for anyone. It's another one that literally any Fitzpatrick can be treated with it, which is another fabulous way to do it. It is really, really good for also that glow, and it can be done. I think it has a little bit less downtime than maybe MOXI. Like a light MOXI is probably the same, but definitely lighter than Halo, and is usually a lot more comfortable as well. We numb you, and most patients are barely even feel it. Honestly, most of the time people are like laughing more because it vibrates so much that it tickles them. So if people are giggling through it. We like it also. We have been dipping into using it in conjunction with BBL. If
Love it.
people's concerns are pigmentation, microneedling can help to lift and work out pigment over time. It's not going to be as instant as like a BBL would be, but the combination of the two together can be stunning, especially if they have concerns with any redness or like broken capillaries or anything like that microneedling might not lift, like actual hyperpigmentation.
Is it something that you can use like the RE-Essence and things like that with as well?
Absolutely.
Like
Yeah.
Topically as
Yes,
okay.
in a stunning
To
way.
improve
Yeah.
results. I love that.
Yeah,
Incredible.
same way. It just not only elevates your results, but quicker healing time, all the things. And you do them in a series of, you can do one-offs, but for your first time, we always recommend a series of 3 or 6. Kind of talk about the difference between the two being, if we have a lot of goals and a lot of correction to do, definitely going to do the 6. If it's something like you're just turned 30 and you're trying to get into skincare and preventative skincare.
That's what I'm looking for.
Yeah,
Yes,
I
me
know.
too.
Honestly, I think I might
I
only
just
need.
turned
I might
30
only
this
need one.
year.
Honestly,
I'm
But-
not sure. I don't
think
think
you
I
just-
need anything.
No.
Honestly, you don't need it. Maybe just a good
Right.
face wash and
Right.
A good
exfoliant.
face
No,
wash.
I'm kidding.
St.
St.
Ives.
Ives.
St. Ives. The series of 3 would be more for preventative. It would be for the younger patients or someone who just needs to maintain or slightly elevate maybe some of their skincare or just their skin health in general. But in those series, whichever way you go, if you could just throw one treatment with Airy Essence in it,
Oh, game changer.
like just try it once. I think it's
changer.
fun to do it without it 1st, and then on your second one throw it in, and
Yeah.
then you're sold for life
I'll
because
never do
you
it without it again.
literally
I won't.
feel
Yeah.
and see the difference.
yeah.
Yeah.
That's really cool. I have always said, like anybody on a budget, I think microneedling is the biggest bang for your buck that you
100%.
can get at a medical
1,000%.
It helps
spa.
pore size.
Yep.
Fine lines and wrinkles. Pigment. Scarring.
Yep.
Mother-in-laws. I don't know what else.
Literally
All of it.
anything you can
Weight
think
loss.
of.
Everything.
Yeah,
Weight
microneedling
loss.
truly is one
Firming
that
and toning.
Yeah.
it literally does.
does.
I know.
I've seen it done above the knee, abdomen, like anything that you want to improve and firm.
I think it is the
stunning
biggest bang
for.
for your buck that you can
I
get if you're on a budget.
love
Andy, how long
lasers.
does it take?
It takes literally, I think, less than 15 minutes for actual treatment. We'll have you in there for like 30 to 45 minutes to numb prior, and then we schedule the treatment time for about 45 minutes. But usually you're done well before that.
Andy, do you only microneedle your face?
I was gonna ask that.
You can do our standard microneedling treatment includes face and neck, which I think is incredible, an incredible bang for your buck regardless. We can talk about the floating head syndrome all you want, but anytime you get a neck treatment when you do the face treatment, it is just
You
10
have to
times
do
better.
neck
You
with
have
face.
to.
You have
You really
to.
have to.
And I love that we
Because-
include it.
Yes,
We include it.
exactly.
We don't give you the
That's our
option. You're-
standard.
It's face
Yeah,
and
yeah,
neck.
yeah.
Exactly.
Yeah.
You can add on chest. You can do hands. You can do body areas. If anything that has like that creepiness.
Didn't we just have a patient who every time she came back in, she added on
something
another body
different?
part?
Yeah. Yeah. All
I
the
was
time.
like, wait, I want my thighs. Wait, I want my abdomen. Oh, wait, I want you to do my back.
We just need one. Well, I've said that before with like BBL.
Yeah.
I say
No, for
that
real.
I wish that we had like a tanning bed of BBL, just like one big zap.
Bam.
Just like full. Yeah.
Yeah.
Work on
Sometime
that.
Listen up.
Just a big zap.
Yeah.
We just like lift off the bed.
Just
That would
one
be
quick.
amazing.
It would be fast. It's fine.
I know.
But yeah, it's really limitless, and using it and when you dip into like the scar treatment side of things, because it creates those little micro injuries and helps to remodel that like collagen in the wound itself. It is it's probably my favorite treatment ever.
Yeah.
And I was about to say, I love lasers, but I will get microneedling tenfold
Yeah.
Yeah.
before I do a
Well,
halo.
and I love that they work together. So
They do, yeah.
If somebody has had a microneedling series and then next year they want Halo, I'm gonna get after it with Halo.
Yeah. Yep.
I can get after it with Halo because your skin is
conditioned.
ready.
Yeah.
Or if you want to preserve what you have gotten from your laser treatment
Yep.
and you want to step into starting doing microneedling, great.
Insane.
Game
Yeah.
changer.
Yeah.
They really complement each other.
Yeah.
And they really give you long-term results that are easily
It just builds and
attainable.
builds.
It's
yeah.
not this or that.
You know, no.
It's this and that.
When-
When can you do each?
I
Yeah.
agree. So you brought up a good point.
Yeah.
I didn't even ask this. So like Halo, BBL, MOXI, we talked about face. Can you do that all over your body? Do people do that all over their body? Like what would be the reasoning?
I've moxied legs.
Okay. And for what reason? What was the reason they wanted it done? Like
Pigment,
laxity? Oh.
texture,
Okay.
just anti-aging.
Okay.
BBL
BBL's
all
a big
over.
one.
We did
Yeah.
BBL with the moxi.
And BBL does
On
like
legs.
the dark reds and browns.
Yeah.
Okay.
Amazing.
Yeah.
A little like secret part of BBL is that you do get some skin tightening. Thin skin, under eyes, neck, whatever, knees, elbows, you get superficial skin tightening with it.
Interesting.
So,
Well,
You can
it's
see
heat,
it. It's heat.
right?
Yeah. Just
Shrink wrap, baby.
yep.
So that brings up a great point because like crepey skin, you know, like as people like in their 60s or whatever and their skin gets really thin and kind of crepey.
Yeah.
I keep seeing all these like miracle creams that are, I think it's like Heather and Dr. Dubrow have one out that is like this miracle cream that like fixes crepey skin. And like, is there one? Is
Well,
that
half
possible?
of that is
And
just
hydrating
moisturizing.
it,
Yeah,
Moisturizer.
I agree.
Half of that is
But
hyaluronic
for the
acid.
older people with like the thinner skin,
Yeah.
that's like kind of crepey. Like, what? Like, is there anything that can help that? Like
Retinol?
topically or
Topically,
Doesn't matter.
or-
Whatever. Like, whatever you think.
yeah.
a treatment.
And yeah,
Like-
anything that we're gonna do though, and I had this conversation with a patient today actually. Anything she was asking me about, biostimulators and Sculptra and heat treatments and whatnot. Again, with some crepey skin, it was like, so all these things are meant to stimulate your body's own healing potential, and you are going to do these things as long as your body is able to give you a good result. But when you outrun that, hey, we know somebody else. You're not going to continue to outrun it.
Yeah.
So
Yeah.
when you are in your 60s and 70s and whatnot, genetics play the most important factor.
Yeah.
That's going to be the biggest thing.
Lifestyle.
Yeah.
Lifestyle is going to be
This
the next.
Probably doesn't help.
And
Cheers.
hey, quality over quantity.
That's why I know a good surgeon. So I can keep drinking. Oh, I was gonna ask for another one. Thank you,
Well,
Jillian.
aren't you just
we
My
love
favorite-
you.
God
Thank you.
bless.
Take that. Oh,
God
hang on.
bless. I mean,
Would you like any more?
Julian.
Our resident bartender.
Yay!
Cheers.
Here, allow me.
Oh, thank you so much.
Okay.
Oh,
I hit my finger.
Okay.
We'll get
Those are
another
the
one
press
here.
ups, are they? Or are
You
they
want one of these?
like actual nails?
Your dip.
Like
Certainly not.
I know
I
they're
know.
I know.
Don't quit. Don't
I think
quit.
you were in
Sorry.
there. I go, I wear them for 2 days and they fly across
Mary
the room.
Poppins.
Yeah.
Literally.
Thank you.
Okay.
You're amazing. MVP.
Yeah, how we looking?
Anyhow, I was having this conversation with a patient and I was explaining to her that you will eventually outrun what your body is able to do from a collagen stimulation.
I feel like I'm there.
You
I'm
are
running.
not.
The
I'm
race has
running
been
from the
run.
wall,
You are
baby.
not.
This is a
Stop.
conversation we have with any of the biostimulators, Sculptra, Radius, PRP, PRF, eventually REScence. Like
For
it's,
sure.
it's a thing.
Yeah.
Like we're trying to stimulate your body to do the best job that it can to heal itself after we have created a controlled injury.
Right.
Okay. But at some point, maybe in your 60s or 70s, a miracle cream is going to make your skin look better for the next 12 hours, and then you're going to be back to baseline.
Yeah.
At some point, your skin laxity and skin quality is going to be past the point of what we are able to do from a non-surgical standpoint.
Yeah. That's a tough pill for some people to swallow.
100%.
Very much so, yeah.
Well, then let's have a conversation far before that point
Yeah.
that discusses genetics,
Yeah.
lifestyle,
Yeah.
and preventative things that you can do. So there are non-surgical things you can do that you're going to put a hiccup in the aging process. And that's how I describe it to people. They're like, how long will my laser last? My Morpheus last? My tox last? All this stuff. As long as it takes you to age is always my answer. Because you're still going to age. We're going to put a hiccup in it.
Yeah.
So you're going to, if you went side by side with your identical twin, you're going to age slower if you're looking at it, but you're still going to continue to age. So let's get you before you need the miracle elbow cream or whatever it is. I'm here for it.
Yeah.
There are things that's so weird that, we were talking about earlier that you were like, oh, that wouldn't bother, whatever.
Yeah.
When I was like 30, I was like, okay. Now I'm like, oh my God, what happened? What happened? My phone.
What happened?
I know. I moved 1 centimeter.
That's hilarious.
But we are never going to outrun
I know.
the aging process.
Oh,
It's about putting a hiccup in it
Yeah.
and giving your skin the best possible outcome quality-wise that we can get now.
Yeah.
Yeah. What is so we kind of we brought up surgery, so we might as well just go there. So surgery, I'm heavily involved in surgery. I talk to a bazillion patients a week. And incision, I don't say scar because plastic surgeons have incision lines, not scars.
Right.
But we'll just say scar for
Yeah,
just
yeah.
the sake of comedy.
Yep.
Yeah.
So patients are concerned about their scars, and rightfully so, because it's like, well, what bothers you most? The loose skin, the stretch marks, the whatever, or will the scar? And we'll have those conversations when they look at before and afters and things. It's like, they're like, "Ooh, wow, that scar," especially like tummy tucks. I'm like, well, yeah, it's a trade-off. Like they have to cut you open to remove the problem and sew you back up. And yes, there will be a scar. And so some will be really upset about it. And I'm just like, well, that's an internal battle you have to decide. What will bother you more? Is it the scar looking at that every day, or is it looking at the reason you walked in the door today and what's going to be the path of least resistance? So we'll have those conversations. So we'll start with laser, and then I want to get into Andy and her paramedical tattooing and things like that. But laser-wise, what can we do to help, like with surgical scars?
Yeah. So
or injury, like if people get in car accidents.
For sure.
Yeah.
So I usually start out with what bothers you the most about it. Is it the fact that it's raised? Is it the fact that it's wide? Is it the fact that it's red and not flesh colored? And that can really kind of drive you to know where the patient wants to go. So if it's because it's raised, you can do something as easy as a steroid shot. But then that's not so easy because it can hypopigment and then get wider. So it's really important to kind of talk through all the different treatments you can do. We can do Morpheus. Morpheus is great for raised scars. It's great for pigment. We've had great results with Morpheus 8 on brachioplasty scars on the underside of the arm, like knock it out of the park results. So the other thing we can talk about is, do you need an ablative laser, or do you just need to go see Andy? And now that we have Andy doing scar camo, it's a game changer. It's a game changer.
Yeah.
Like typically before I recommend any sort of laser, I will get her expert input before I recommend something else. And then we can kind of formulate a plan together. Maybe it's me doing BBL, and then it's her doing an inkless, So that's again, going back, like working as a team, having the experts. It's like a full house.
Yeah, I love that. So tell us like what you can do for
Scars.
For scars. And like what, because I know you do inkless and then camouflaging.
Correct. Yeah.
And there may be more, but I think that's the two.
Yep.
So talk about those a little bit and like what they can help with.
Yeah. So I do something called inkless scar revision, and then I do something called scar camouflaging. I feel like scar camouflaging is more of the general term that I'll hear or patients might have heard of or refer to a little bit. It's kind of like microblading versus nanobrows. There's a general term that everyone knows. It might not be correct, but anyway. So the difference between the two is, one, I'm actually putting pigment in the skin, and one, I'm just using a serum or some sort of glide to basically work to help break up that scar and rebuild and break down tissue and all that good stuff and make it prettier. The exciting part about the inkless scar revision is when we start talking about surgical patients, you can start doing that as soon as 6 weeks post-op or post-injury or whatever it is, whatever caused the trauma to your skin.
For some,
Yeah, and it is totally dependent on how you heal individually. 6 weeks is kind of our standard look at, but like you said, some people
which is a
heal real
total
quick
shift from what we were able to say before.
Yes,
12,
I think
12 weeks,
at
3
least.
months.
Well, I think the standard was 6 months. Up until maybe 3 or 4 years ago, there was a study done by SkinPen. It's a microneedling device, but they did it specifically for surgical scars. I think one of theirs was a brachioplasty. Started at 6 weeks, every 4 to 6 weeks for 3 treatments, just to optimize that healing and prevent as much, if it's hypertrophy or if it is pigmentation or whatever that may be, just to smooth it out. And the difference is crazy versus, you can't guarantee how you're going to heal from a surgery, but if it's might be a concern for you, it's absolutely worth optimizing that ahead of time, because I promise it's a lot easier to intervene during than to backtrack once we're years down the road and we're unhappy with something.
But you can do that.
You absolutely still can, because
I've seen you do amazing things
Thank you.
years down the road.
You absolutely can still do it. Like I said, sometimes it just might take a little bit longer because it's set in its ways.
More
It's
mature,
it's learned what it's doing. It's happy where it's at. It doesn't want to change. So, like we don't want to change half the time. So it can be more stubborn when it is older. Still very treatable though.
Yeah.
And that's kind of where we start to combine the inkless scar revision and the scar camouflaging aspect of it. Kind of like when you ask patients what is their biggest concern with the scar, whether it be pigmentation or texture or whatever. When we're looking at both options for a patient, if there's any textural issue, or even if they are hyperpigmented, and actually now too hypopigmented, there are sometimes that we can use the serum to see results before I even need to go to the pigment route. I personally always recommend starting that route if I even think that it can improve your scar, because it's going to be a permanent improvement. I'm actually treating the skin and your cells. I'm not adding anything to it. I'm not putting anything over top of it. Your body's correcting itself.
Yeah.
So that's going to live there.
Yeah.
Once we do that and we get it nice and smooth, or if we need to still go in with actual pigment, and I don't think that we can improve it another way, then we can put pigment in that. And if it's a super dark pigment, or if it's a super dark scar, I can brighten it up and even it out and neutralize it. If it's a perfectly white flat scar, I can fill it in and camouflage it with the rest of your skin. There's a million different routes that we can take, and it usually is a combination of both, depending on what the patient's looking for and how old the scar is, what skin type they are, many different things, or what their end goal is too. Which is funny, we talked about earlier today, or I can't remember if you were there, but anyway, there are sometimes patients some things will bother them that we would literally never notice, which we're all like that.
Which is why you have to ask.
Yes, that you can never, ever assume, ever. You learn this very early on in any aesthetic world. But some people have scars that yesterday I saw one of the most perfect, beautiful brachioplasty scars I've ever seen.
It was gorgeous.
And she wanted to come in
It
for
was literally
camouflaging.
this wide, and it was this thin little line.
It was
you could
thin,
barely
white,
even see
it was flat, and I was like,
you couldn't ask for a better result.
I was like, absolutely, we can treat this. It's gonna be, you're gonna love it. But this is funny to me because and she knew it was
It's
good
gold.
too.
It's
But I was like,
gold.
that is literally that's a great scar.
Yeah.
And I don't care to tell you that. I'll absolutely still help you out, but I think it's a beautiful scar. But sometimes people would love to have that, and then other people have a much more raised or pigmented scar and it doesn't bother them at all. So the scar treatment's totally customizable to how far do we want to go, what results do you want to see, and what's realistic. So
I think it's important to point out that Andy has a really great social media page, and when she's talking about fixing old scars, that you should go check it out because there are things on there that are incredible.
Thank you.
Incredible.
Yeah.
I mean, there are old self-harm scars that people may not want to live with forever.
Yep.
There are old surgical scars that maybe came from genetic factors that people didn't want to have to deal with. It's incredible.
Yeah.
It gives people a new lease on life that they thought they were kind of stuck with. So it's wonderful for surgical scars, but we do have people that are really, really benefiting from decades old scars.
Well, and 20 years ago, people were actually tattooing their scars, in the way that we think of a tattoo.
Yeah,
Right.
exactly.
Like putting ink in a design, and now we're tattooing in a whole new,
not be noticed.
We're tattooing in flesh color.
Yeah.
And that's like the
It's
thing I should
it's such a
clarify,
different
too.
shift in mindset,
Yeah.
and it's amazing.
Yeah.
And I'm here for both of it.
Yeah.
Right.
a million,
And that's where it's total personal decision.
Yeah. But for people who just are really unfamiliar, when we're saying paramedical tattooing and cosmetic tattooing or inkless tattooing or camouflage tattooing, it's literally tattooing.
Correct.
And you're using, so kind of, I think the camouflage people understand you're using a skin flesh or a skin tone color that you match. It takes a long time, and you tattoo it on to camouflage it. The inkless may be a little more ambiguous for people to understand. So try and make that make sense for people.
So it is a very similar process, like you said. It's tattooing. I'm just replacing the ink with a serum that is, like I said, there's a couple different options for it. I have some that are going to be brightening, that are going to help to break down or lighten up any of that darker melanin in the scar. There are some that are just good for retexturizing it and also just helping to like it's also more of like a glide as well, so the actual treatment goes smoothly. But the star of that treatment is really the pen and creating those injuries in the skin. Obviously the serum is our little boost to make it specific to what their concern is. But we're just creating little micro injuries in the skin. We're helping to break up, especially if it's like a tight fibrous tissue or a scar that's raised or anything like that. We can see so much release by going in there and breaking up that tissue. And that's really where the magic happens with that treatment, is the actual tattoo needle. Yeah.
Well, and I've experienced it firsthand, like huge testimonial to you. So I had, I started young having children and I had stretch marks out of the gate. And I gained way more weight with my third, but my first one I was young, so I only gained like 20 pounds.
Yeah.
I got so many stretch marks with my first pregnancy and it was like, made no sense. Lived with them, hated it, was young, just like, you know, when I tell you I've tried everything, I have tried everything for them. And I have seen some results with things, but I've never seen, and it could just be me. I'm not saying it works for everybody, but I'm saying for me personally, you did the inkless on me.
Yep.
And I am blown away by how my stretch marks look.
And
like,
it's crazy.
Insane.
And I think we only did one treatment on them.
One.
Yeah.
One. And I had like the
And
wider
how old
one.
are these stretch marks?
30 years old.
Okay.
30 years old.
So
30-year-old
it's never
stretch
too
marks.
late.
No.
And like, I mean, I had wider ones that are now like that thin little line that you wouldn't even notice.
Yeah.
And I had a tummy tuck and I had an umbilical hernia with mine. And so like around my belly button, I was a little hypertrophic, which means for people who don't know, a little more red and
Raised,
thick and a little raised. And you did it you did a steroid injection. And exactly what you said happened. It kind of widened a little bit. And I was in Florida, surprise. And where it widened, it was white. So like it was a pretty generous area that around my belly button was just white. And then I was tan everywhere else, which I didn't really care. I'm like, I loved my results. It was like, whatever, I didn't really care. You did it on that. And it's completely gone. I don't even know if I told you that. I would literally stand up and show you guys right now. It was this much white under my belly button. I kid you not, from what the steroid injection did. And now it's completely gone. I'll have to show you afterwards. I don't even think I have.
No,
and
I had a patient that was like, Carrie was raving about it, and I was like, oh good, I haven't even seen her results yet, so
it must be good.
I haven't seen her.
You did one on me, and
know.
I plan to do more, and I'm gonna have you because I know I'm a bad scar genetically. Like I just know I am. And like on my abdomen, I have a couple little spots that are a little red that I want you to camouflage, and I don't really care. But I'm like, when it's in my bathing suit line, that skin's never going to tan or lighten, so it's going to stay consistent. I might as well, if it bothers me, like why not? But I was so shocked. Like it's
crazy.
When I tell you, it really, really works. And it's just really, I just am very impressed with
for
that.
stretch marks too. It's huge because there's really not a ton
There's
of treatment.
anything for stretch marks.
That really does a good job.
And trust me, I have tried everything. I'm telling you, for 30 years, I've tried every ointment, every modality, every laser, every needle, every whatever. And this is the only thing I've seen a significant change in them.
It's crazy. And the reason I love it so much, because in some ways it can be very similar to microneedling, but for stretch marks and scars specifically, I love doing the inkless scar revision with my tattoo pen because I have a million different options for my needle cartridges. So they can be as wide or as tiny as I want them to be. And when we're doing scar treatments or stretch marks, I want to be very specific with where I'm placing pigment for sure. But when we're doing serum, I still want to be specific in where I'm placing my product. And it gives me so much control, and we can be so precise and fine tuned and custom to you that I love it.
I mean, and what a gift to our surgery patients.
Yes.
Right? Like everything
because
comes full
with surgery,
circle.
you can't do a lot with stretch marks.
No.
I mean, you can only remove
and you can only heal how
Yeah.
you heal, right? Like your genetics will dictate how you're going to scar mostly.
But it is what it is.
It's the same surgery on everybody, and everyone can heal differently. You know,
what a gift to our surgery patients.
a 1,000,000%.
It goes hand in hand.
I get this question a lot. So like the camouflaging, obviously I think no brainer on breast and like tummy tuck scars because they're hidden like in bathing suits and things like that. So your skin's pretty consistently the same. Like you can match it pretty well. how do you handle like thigh-plasty and arm lifts? You know, because that skin can get sun.
Yep.
It's exposed to the sun more, so it can change and get a little darker, a little lighter, a little darker, a little lighter. How do you handle camouflaging?
Yeah. In some ways, it can be similar to laser, where I really do want you to be at a pretty base level when I'm matching you. I tell patients for at least your first treatment, I usually see anywhere from 2 to 3 when we're doing camouflaging, just totally depends. For your first treatment at least, I want you to be at like your base color. So it, you know, I wasn't doing a ton of it over the summer because of that. And it's seasonal. It's the same kind of thing. But depending too, it's also personal preference on what the patient cares about. But I'll answer your question first, sorry. But when we have some color with the skin, I always let patients know the pigment is not going to tan with you. So we want it to match your base color or where you're at most of the year. It doesn't need to be your palest winter shade. It shouldn't be much darker than that because once again, then we're going to have the opposite problem of a darker scar. But just something that you're comfortable with. Normally that's like our pale fall to winter shade. But I've had patients before where they're like, I have self-tanned every Thursday for 10 years and it's never changing. And I'm like, okay, I'll treat you it then. And you talk about why you normally wouldn't, but they understand and agree, and then you do it.
Stop, they'll come back and you can make it later.
I'll see you when you're done with it. But yeah, so when you do tan and you have them, it won't tan with you, but it'll be a less drastic difference than if you had no treatment at all. So when it comes to, you know, areas that are visible anywhere on the leg or the arms, brachioplasty is one where I have patients that go either way. I actually just completed a brachioplasty case that was over the summer because she's like, I literally am not getting sun in that area. And I saw her all summer. I know she didn't get sun in that area. But then I have people who, I don't know what they're doing, but they do get sun in that area where it does matter. Yeah, they're laying.
I wear my sunscreen all day.
Okay. So it depends on your lifestyle too, like when we can treat, where the scar is at, what's realistic. There's just, and you do want to be careful with sun exposure afterwards for a little bit too. So that kind of comes into play when we talk about timing.
I love that. I just am pumped about it. Like, cause having been here, like I said, 8 years and we were limited, you know, like what we could do for people. Yeah. So that's awesome.
For sure.
So you do other tattooing.
I do.
So talk a little bit about, like, just talk about your other stuff. You do some cool, like, I didn't even know lip blushing was a thing until like you started doing it here.
I absolutely love it. And so I do all things cosmetic tattooing. So that looks like brows. There's nano brows, powder brows, all kinds of terms for that. There's lip blushing. There's eyeliner. I've done freckles before, or little like beauty marks. I don't do this, but I've seen people do blush. I would never tattoo blush.
Oh, really?
Interesting.
I know where my model is if I need one. But yeah, it's just anything like that. It's an interesting one. I'll think about it. But I personally do a lot of brows and lips. Do some eyeliner sometimes too and freckles, but those are my big two. Both of which I've done in a way that can sometimes dip into the paramedical side of things where I might be doing some scar revision in it as well. Those are the really fun cases because I get to use all the parts of my brain when I do those. And they usually make the biggest difference to the patient. So that is, like I said at the beginning, giving that confidence back that is really key. But we can do brows. What I like about cosmetic tattooing versus other modalities out there is that it's so airy and soft and natural looking. I tell my patients all the time because understandably everyone's concern is like, I don't want to look like I've Sharpied on brows, or I don't want someone to see me.
Prison tats.
Yes.
Prison brows.
I don't want someone to see me from across the street and know like I have these crazy brows. So I always tell my patients I might be one of the only like artists that I never want my work to be noticed because it should be undetectable. Like scars, brows, everything. That's my goal in the end, is to look like it's yours. There are, when it comes to lip blushing, there's many reasons that we can do it, different causes or different concerns for people. Sometimes people start to lose their lip line, sometimes with filler over time, sometimes some pigment can change or soften a little bit. with trauma around the mouth, with really anything, we can reshape the lip a little bit, but really just give definition and clean lines and bring back some evenness and color to the lips is another really cool way to do a treatment
I
as
just
well.
saw you posted somebody who had like hyperpigmentation in their lips.
Yeah.
Like they were kind of darker, like I had a thicker, darker rim around this part and then a little lighter in here, and you just kind of evened it all out.
Yeah, so
It was
that
really cool.
that's another really cool
And very
one too.
subtle, like
Yeah. That one is more like lip neutralization. And it's basically what it sounds like. I'm going to neutralize out any of that dark pigment in the lips, especially if that's a concern for some people, or they don't like how dark it looks sometimes. Then we can go in and do treatments to either we can lighten it and just kind of neutralize it out, or we can neutralize it out and then add a color to it. So, you know, if you have darker lips and you want to have a pinky, like a light pinky lip, then it might be a multiple step process, but we can get you there with both ways, and it's
the results
great.
are so pretty.
Yeah. And
So
I
pretty.
I've seen all different walks of life for these types of treatments, and it's really cool because there's very few people are not candidates for it, which is another reason why I like cosmetic tattooing specifically, because it's really great for any skin type or anything. But so many people can benefit from it in ways that you don't necessarily think about. And it's interesting because I have the conversation a lot where people, because it's cosmetic or it's a tattoo on their face, they feel like it's unnecessary or like they feel bad or guilty for coming to talk to me about it. But if it makes you feel good and it gives you back any part of your life, then it's absolutely worth it.
Absolutely. I totally agree. How we marry lip filler specifically with your little blushing that we have going on. I assume that's like a hot little thing like we've got going on.
Yeah, that's one of my favorite as of late combination of treatments to work together on.
What's the order?
I was going to say, a lot of times, just because it's one of those things that they don't know that they need it yet. So they will go to an injector, or they'll go that route to do a consultation for what they would assume would be for filler, because they're thinking that they might want some definition in their lips, if it's a lip line definition thing, or they need more volume, or it's a visual concern.
Always ask for more. They're like, I just want my lips to be bigger. I just want more. Or they've had more and they don't like that they've lost the definition, because when you add volume, at some point you're going to lose some of the lip border definition. And at that point, you know, we didn't have anything before. It was like, okay, well, I can't add more filler. You're going to look dumb, you know, or we can back off. Like, we can try this. It's not going to be a great look. But now I'm like, you know what you need? Go see Andy.
You need the color, you need the definition, that crisp lip line.
What you're looking for is not something filler can give you. What you're looking for, you need more definition at the border.
Yeah, and I feel like we see it from both directions of patients coming in, where they are a filler patient and they keep wanting more. They lose the definition that they might have had before, or they just are looking for that. Or you have the patient who might not just have much natural definition at all and never had filler, but they think that might be their resolution for it. But in reality, it's back to lip blushing and the pigment definition. It works beautifully together. It is such a game changer, and it can really change like your full face. You can do it in combination with paramedical as well, and do things like a cleft lip patient once that symmetry and that definition, and once we achieve that, then we can go in and give more volume, and it can be something where it might be one or the other, but both together, if you want that, is stunning.
We can give you a B+ on either side. You could have cosmetic tattooing, you could have lip filler, but if you want that A+ home run result, it is a combination.
It's both.
And I love being able to refer people to Andy and say, you know, I can give you up to this point, but when we get there, like when you get to her and she does her part, it's really what you're after. Because sometimes you don't know what you're asking for. You know what you want.
You know the problem.
Well, how would you know? I mean, why would you know? But when we are able to like offer both sides of it, it really makes such a beautiful, pretty, long-term lasting result.
That's why I love. Oh, go ahead.
I was just going to say, like, the longer you do this, the longer you're an injector, the longer you're doing paramedical tattooing, you realize your own limitations, right?
Yeah, for sure.
And so it doesn't have to handicap you if you're surrounded by other people that can help you.
Yeah.
So this is such a great referral for us on both the surgical side and the non-surgical side.
I agree. Totally forgot what I was going to say before I was getting ready to talk. I think.
I do think that's an important thing to say because I was watching back at a podcast that we did a couple years ago, a year and a half ago. And the things that I was saying in that podcast was how I felt exactly at the time.
Yep.
But you should be a forever student when you're in this industry. You should in any medical industry, but especially. And it is forever changing. We are going to do the best we can with what we know. I'm only ever going to tell you the latest, greatest. I'm going to give you the most up-to-date information I can that I
We
trust.
know you're honest.
As are you. As are you.
We
So,
all
unfortunately,
superpower.
Yeah.
honest to a fault across the board here.
Yep.
Unfortunately or fortunately, I'm not sure.
Depends who you're asking.
Yeah, it depends who you're asking. But that is something that even looking back at things that I said a couple years ago, it was the best I did with what I knew. As things progress, I'm going to continue to update that, and that includes what we're doing right now. I mean, I didn't have the option of cosmetic tattooing, paramedical tattooing, anything like that to recommend to my patients a couple years ago, and now I do. And I also know that a couple years from now, we're going to be able to offer that plus something else.
Yeah.
Like, we're just getting better and better. And to your point with the lip filler patients specifically, we only had one option before. You come in, you get it or you don't.
Yeah.
And
you
now-
get it one way.
One
You
way.
get it one way.
One
You
You get it one way.
You get it one way. And now we know different injection techniques. We know different placement areas. We know, different cosmetic tattooing options.
Different
We know
anatomy, too.
Different anatomy.
Different product.
The landscape for it has completely changed. I think that's so important to know that, like, as a group, we really lean into that and we embrace that, and we are not, this is it. I've learned one way.
Yeah,
That's
no.
it. Old dog, no new tricks. That's not us.
No.
Yeah.
You should be constantly evolving and changing, especially in this industry.
I remember what I was going to say. Thank you, Dr. Weston. When you were saying, I think it was Adrian was saying, how people don't know what they want, or maybe it was Stacy. And I think that is so true, especially with Google and social media and TikTok. They come in thinking they're Dr. Google or Dr. TikTok, and they're like, oh, I want this. And I love, you guys said it earlier, that when you sit people down, you don't say, well, what do you want? You say, what is bothering you? So when they're telling you, like, this is what's bothering me, they think they know what they want. But I think that's a great way to approach the conversation, because you're not, oh, like, what can we do for you today? What brought you in? Oh, I want this laser. But instead you're like, well, what's bothering you? I think that's such a great way to start the conversation, because then you really get to the root. And then they can, don't worry about what they learned. You can just give your advice based on that, which is kind of cool. Yeah.
It should be, what do you like about your face?
Yeah.
What are you wanting to work on?
Yeah.
I would say you're the quarterback. I'm the coach. You're going to be out there calling the plays.
Yeah.
I'm going to give you my recommendations. Like, that's what we're going to do.
What is your take on the, what are they, not Essence, but the other form of it? What's it called?
PDGF.
Yes, for under eye.
So I do love PDGF for under eye rejuvenation. We know that platelet-derived growth factor stimulates some tissue growth. We also know that it causes some angiogenesis, which is wanted. So there is a concern with
Angiogenesis for
blood vessel
vessels.
creation.
us dumb people.
For the layman.
Blood vessel creation. It does a great job at plumping the tissue, creating a little volume, helping with crepey skin, some dark circles, fine lines and wrinkles. It is a very off-label treatment. That same PDGF formulation has been used for years in other indications and has been very successful. I feel at this point very confident about placing it in the under eye to provide a really pretty under eye treatment that's going to lessen dark circles, volume loss, and some crepiness. Personally have had it done, thrilled with it. I would also say that it is wonderful in areas of high mobility, including nasolabial folds, under the chin, crow's feet area. There are some preliminary things that are out there right now that it can increase the longevity of neurotoxins. At this point, there's not been an aesthetic study done on it. Fair enough. There have been numerous other studies where it has been used in other indications for, bone growth and joint healing and wound healing. I love it for under eyes. Right now, it is my favorite under eye treatment that we can offer anybody. There are some limitations, obviously. There are some ideas out there that anytime you feed anything with a growth factor, right, you wouldn't want to. If you come to me with a weird sinus cancer, you're not getting PDGF and under eye. But other than that, it's been an incredible treatment.
It's far superior to filler
For sure.
in
Well,
95% of cases.
Yes.
There
The
will
other-
always be a caveat, but
The other way that we're using PDGF that's really interesting is that we're using it as a pre-feed. Okay, so if you know that you have an upcoming Morpheus treatment, microneedling treatment, laser treatment, we're injecting it into the areas that we know we're going to want to work on a little bit more. So maybe the under eye, maybe nasolabial fold.
Prior to the treatment?
Prior to the treatment, about a week before. And then we're going in and we're treating that area, whether it's with a controlled injury or heat or a combination, and then either topically layering it afterwards or injecting them afterwards, and the results are phenomenal. Phenomenal.
Interesting. So, last thing before I get into the computer, the Tighten and Brighten package. Let's talk about that. So, some people don't want to do surgery, or want to be really aggressive on prevention and see like a more dramatic result. So I know we offer a Tighten and Brighten package, and we've seen really great results with it. What's the non-verbals? I'm kidding, Stacey.
she's looking at me saying, now I have to
There
talk.
you go. Let's talk about it.
It's outside of my scope.
Listen, I'm trying to take turns.
Take
Sharing
turns.
is
Oh, she's so fair. Your
I know.
turn.
Fair. I know so many people say that about me. It's so weird.
That's so weird.
So Tighten and Brighten,
Yeah,
go.
Tighten and Brighten is like a homemade Donaldson recipe, okay? So Tighten and Brighten came about just from all of us talking about our experience using different modalities. So Morpheus 8, radio frequency, not a laser, but then people needing treatment for their pigmentation afterwards. Then we lean towards BBL. And then you think, well, everybody needs a halo because halo is amazing. And so it all just kind of came together as a perfect storm. And we were sitting around in our office. We were like, well, what do we call this? Like, what do we call this? And you said Tighten and Brighten. And we were like,
Cool.
heck yeah,
Check.
check. That's it. Because that's what it does, truthfully. Like you get a brilliance to your skin, that BBL brilliance. You get tightening from the Morpheus. You get the concomitant tightening with the halo. It's so
halo
satisfying.
love.
It's a 6-month commitment. I'm not lying to you. It's not like for the faint of hearts that's like, I'm just going to come in once a year and I'm going to do this and I'm going to do this. This is like, you're going to use this skincare. You're going to come in and you're going to see me every 4 weeks. You're going to use the products we want you to use. And when you do it all together, the end result is
Yeah.
chef's kiss.
It's incredible.
It's amazing.
It's incredible.
We've had so many great results from that. It's not a facelift.
No.
It's not a neck lift.
Right.
Yeah.
But these people haven't had surgery.
Yeah.
It's incredible. So I'm really proud of us. I think we put our heads together. We came up with it. We execute it beautifully. And I love it.
So come to the laser event to learn about Tighten and Brighten and how it can transform your face, and meet these lovely ladies, minus Adrienne, because she'll be in another country being fancy and learning.
Well, she'll be learning.
Yeah, okay.
Learning.
That is if she makes it through flight. But that's a whole other story.
Prayers,
Oh,
thoughts
that
and
was-
prayers.
No, she'll survive the flight. Will she pass out or
No,
will
she won't.
If she doesn't survive,
Not
it'll
This
just
isn't
voluntarily.
the international one.
Well, lucky for you, I'm flying to Florida for this one.
Yeah, this
Oh,
one's
this
just in
one's
Florida.
Florida.
This is
okay,
for
okay.
the
This is in
International
Switzerland.
Society of Plastic and Aesthetic Nurses.
I thought this was the
No.
Switzerland one.
Rolls off
Well,
the tongue.
you know,
Is it Switzerland?
Yeah, no, I
Okay.
just have anxiety the entire month of September. It's
I
fine.
know. I'm sorry.
No, you're not.
I am because I feel it too. I totally empathize with that. We've flown together. You understand that? I hit my head on the thing and
I
almost
know.
concussed myself. So yeah, I feel you. I hate flying. I don't even want to think about what you're going to go through. That's why I said if you survive it, just that you don't die from a panic attack
I
before
love
you
the.
get on.
I love the if.
Yeah.
You know, it's super helpful
When?
as a friend.
Sorry.
If I
As
don't,
a friend,
semantics.
it's very
When
nice for you to
survive
say
it.
if.
if I don't survive the flight,
You are gonna
I would
survive.
love for you guys to all then go see Stacy and Andy.
My
We'll
dying
name-
wish.
We'll
For
name all of
continuity
the
of
treatments.
care.
Guys, we can go through and name all of our treatments after Adrian.
Yeah.
That would actually be super fun.
That would be great.
I
would
kind of
love
want to do that.
Okay.
Yeah, yeah.
I would
we'll do
like
that
you
tomorrow.
to name them all what I would
I'm gonna
actually
name
call
one
them.
Dolly.
Oh, I know.
I'm gonna
Yes.
name them Dolly.
Yeah. I would
One's
like you to
Dolly
call
for
them
sure.
the things that I would actually call them.
You know what I'm making? Titan and Brighton, working 9 to 5.
9 to 5, baby, because that's what it is.
That's what
You
it
gotta-
is.
you
It's
have
the
to do it.
grind.
You have to
It's
do
all
it.
about the
And
grind.
then
It's a commitment.
once it's done, it's done. You're gonna see me, you, everybody for 6 months.
They won't see you. You'll be dead.
I'll be dead. Well, and
We'll have your photos everywhere. Like
For sure. Oh, remember? We did
actually
do that.
we have
Yeah,
a cardboard
fat head of
cut
you.
out.
Yeah, that's true. From a flight.
We couldn't get rid of you if we tried.
Yep, you're forever.
No, because I will haunt everyone.
You're
forever.
eternal.
I will put a hex on.
Iconic.
Iconic. Million. So I Googled some stuff.
Great.
Well, not even
I
Google.
love Googling
Well, I
stuff.
didn't Google. It's just like social media, like trending.
Oh, I love that
mean,
more.
you know, my
Even
feed's all
better.
this stuff
Right.
because that's what we do.
Oh.
And whatever. My algorithm's filled with it. So I'm just curious on your take. And it could be, I want it to be really brief so we can just cycle through it. Just give me like your gut take on it. If you think it's like actually worth talking about, then say something. But just kind of be like,
Yeah.
just give your take on it. The new like salmon sperm facials or whatever. is going on.
Polydeoxyribonucleotide.
What is that?
Yes.
Chromophore.
So, not averse to it. Agree.
Yeah,
I'd give
in-
it this.
Yeah, agree in regenerative medicine
Yeah.
that there is some sustenance to it.
Like how does it
So
help?
it's not a full this.
It would be
it's not a full
better
this,
if it
not
there
this.
was it was
Studies.
getting put in the skin.
So, not necessarily
Is it
different-
topical?
Topical.
Is it
Not-
cream? Is it facial? What is it?
I
Both.
think there's different
People are
okay.
using it in skincare.
Okay.
Not
Yeah.
necessarily different than what we're discussing as it involves growth factor, PRF, PRP,
Okay.
stimulating cell growth and cell turnover. So, not necessarily but I'm not.
Half.
Yeah.
Yeah.
Little more than half. It looks like.
Yeah.
You have a
So
little
like an
weird,
8.
you have a little weird
Oh, that's
projection to your
good.
thumb going
Yeah.
on. Okay.
7.
Okay.
A weird
Now,
That's
shape.
from injecting all day.
like
but-
exosomes, is that like that or is that separate from the salmon?
So exosomes for me are like
5.
a little, here-ish, only because
What are
no.
they?
they are.
They are the FedEx of growth factors
Yes.
and good things.
Okay.
They deliver a package, but you don't know what's in them.
Yep.
It might be the wrong size.
It's the Timu. It's the Timu of PDGF.
Yes.
So right, like
Yes.
you're
Yes.
gonna get what you get.
Yes.
You
Yeah.
think you know what you're ordering.
Yes.
Some people are gonna get something
Yep.
beautiful, and
So
some
it's
people are
the-
not.
You gotta read the reviews.
It's like the Walmart version of PDGF.
You might have a fraudulent charge. We're not sure.
Yeah, we're not sure. No one
We're
really
not
knows.
sure. That's the thing.
We're
Okay.
not sure.
It's the unknown.
So
yeah.
there's no dosage recommendation.
Is it
nothing-
topical or injected?
That's a great question.
Okay.
So yeah,
It's the wild, wild
We're
west.
just gonna move on.
Yeah.
Move
Yeah.
on from that. This one I really want to know about because I have almost hit purchase so many times because it
Oh,
looks amazing
Carrie.
to me. I
Let
know.
me guess. It's going to be a 0.
It's gonna
Those Korean collagen masks that like soak into your skin and you look like a glazed donut and look amazing.
Yeah, I don't know.
Hey,
I mean,
does
there
it
are
make-
worse things.
Yeah, does it make
Yeah,
you feel
okay.
good?
I haven't done it. I haven't bought it. I'm waiting for
Hold
my
on.
verdict.
Like I had a patient come in, she was like, listen, I tried this cream last night and I noticed a difference. And I was like, no, you didn't.
You're
Like it
hydrated?
didn't work.
You're
It didn't
hydrated?
work for your hyperpigmentation overnight.
No.
No.
If it did, call 911.
That's what I said.
Because that you got burned.
But it didn't.
Literally, like you have a secondary burn.
Yeah.
Yeah.
Okay, so you know what? If it makes you feel good, do it.
I know I might try it.
I don't think it's gonna harm you.
All right, Carrie,
But I don't want to waste my
Here's
money
your
if it's
homework.
not going to help.
how much are they? Like 99 cents?
Yeah,
No,
honestly.
they're a little more than that.
Like what?
I got distracted from Bob Ross channel over there.
Doesn't take
Happy
much.
little trees. This is right there. Yeah. That's what you like to watch at a brewery.
Yeah. It's like, yeah.
No, anyway. They,
Right.
I don't know how much they are, but actually I haven't purchased them
Why
yet.
don't you
but
try
I am
it and see what
literally
happens?
Yeah,
so
let us know.
intrigued.
Yeah, try it.
Let's
That's
all
your
try
homework.
it.
I will. I'll let you know.
Clip to us having
I'll
them
let
on
you
in 3 minutes.
Like gua sha.
Great.
Sure.
Just had
Yeah.
the Tatiana
I
organic
heard
wash
for
off
something,
facial
as long as
today.
you're doing it routinely, it'll help. Like
It-
you can't just do once. Like
Yeah,
with
it's
anything else,
like
right?
red light
It's-
therapy.
yeah.
It's
Lymphatic drainage.
Yeah,
Yeah.
that's what
It feels
helps.
good.
It
Feels
feels
great.
amazing. And if you are really consistent with it and you're good at it,
yeah.
Yeah.
you're consistently doing lymphatic drainage, you will see like a slimming of
Yeah.
the face
Yeah.
and whatnot. And it's helping to pull extra fluid out. And it's
Good. I do
pushing
so
it
I'm pumped
towards
about
your
that.
lymph nodes, which will help.
Yeah, doing
Andy.
it correctly and what?
Do that for me tomorrow.
Oh, you're getting a facial tomorrow?
No.
She just
Oh.
does this when we're in the same office.
Red
All of a
light
sudden I got a
mask.
job tomorrow.
Red light mask.
Sure.
Daily use.
I
Yeah.
own one. I bought it last year.
I
I
bought
used it every day for like 2 weeks and,
what
I
did it
loved
do?
it.
Yeah.
And now I haven't used it in 6 months. And my kids tried to wear it for Halloween.
Yeah.
Right.
I love mine. I think it's very relaxing. After
yeah.
you do it, you feel very zen.
It
Yeah.
does
I
work
would-
when you use it.
Yeah.
It's very
Absolutely.
frequent
It-
use though.
So red
Yeah.
light encourages cell turnover,
Decreased
and
inflammation.
wound
decreased
healing.
inflammation,
Yep.
wound healing. So if you are using it consistently, you do see that.
Yeah.
However, you have to be very consistent with it.
Yeah.
Is
Yeah.
it good to use after a laser to help heal faster?
I
I say
You can.
yes. I have had patients ask me even after like tattooing and stuff. Absolutely.
Microneedling.
You told me to.
Yeah.
You're like,
I-
go for it.
Absolutely.
Yeah.
as long
Yeah.
as it's not like something that is sitting on your face,
Yeah,
like one of the
pushing.
masks
Yeah.
that
Yeah.
sit on you. If you can hold it off of your like physically touching you, then yeah, absolutely.
The other time I recommend that is for patients that have had a long history with a tanning bed,
Yes.
who really enjoy
The
the
feeling.
experience of the tanning bed.
Oh, that's a good
Then
one.
by all
Yeah.
means, like, let's try
Yeah.
something different. If you can sit for 20 minutes with a red light, and there are places you can go and actually get in the
They
whole
have
booth.
beds.
You do.
Yeah.
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 So if
I
that's
want
a
one.
trade-off that you are not sitting in a
Yeah.
tanning bed anymore, by all means go do
Yeah.
red light, and you're actually helping.
And
Yeah.
it's beneficial. Yeah.
I
It's a
love
great
red light. I'm
trade-off.
a big red light fan. I just
Yeah,
didn't know
I
if it
like
was
I love
appropriate
red
for me to
light.
be.
I just
Yeah.
don't use it the way I should.
yeah.
Yeah.
Just consistency. That's
I
it.
know. Consistency's hard.
With anything.
Why didn't you guys let me sit here and use it?
I
should
know.
have just done that.
I know. I should have.
If you're not gonna
Um,
use it, bring it to
What
me.
about beef tallow?
Oh.
That's all the rage.
OMG.
What?
I'm sorry.
I had a patient.
Stacey's about to be like, I personally love it. Go on. I'm listening.
Do I look like I have beef tallow at home? Because I don't.
I probably would be the one.
You
to
would.
have it.
You would.
She's like, Carrie would
Just
have
for my
it.
own
You would
research.
have it. I would have it. I don't, but I would. I'm curious.
So yeah, and like I'm not maybe trendy. I had my patient on Tuesday after I did some in-office procedures. I just told her to leave things alone. If the steri strips fall off, use just Aquaphor or Vaseline. And she was like, well, can I use tallow? And I was like, and I knew in my mind, like
Yeah.
I'm like, well, what is that? Like,
Beef fat?
and she was like, well, it's beef fat. And I was like, no, not on a fresh incision. No.
Certainly
However, I don't know anything beyond,
not. It's just.
other than like, I'd just rather not take
Why are you putting beef fat? on
beef
your
fat
Here's the thing.
on,
Yeah.
on my face.
Any place that you would
It's
rub
It's occlusive.
coconut oil,
correct. And
rock,
that's
you know what?
that
Rock
was the
and
second
roll.
thing that she said. Can I use coconut oil? And I
Sure.
said, Sure.
You know what?
We're
Sure.
compromising.
If you want,
Beef
that's fine.
with
It's
Aquaphor.
It's
What's that?
fat. It's fat.
Coconut's naturally
It's
It's
inclusive.
inclusive.
Yeah.
It's
It's
inclusive.
It's inclusive.
Mhm.
It's fat. It's
Yeah.
inclusive. Rock and roll.
Yep.
That's fine.
Yeah.
I'm gonna get disowned from my family for this, but my own mother decided
Oh, no.
that she was gonna make sunscreen with beef tallow. I'm not kidding.
How?
And because she put zinc in it.
Zinc.
And I said, well, that's what makes all sunscreen.
Right.
And my brother was like, if she puts that on my kid, what is she doing? Marinating him? I'm like, I know. I
Seasoning.
know.
A little salt and pepper.
And she's like, well, it's good for
Can we
you.
put some
It's not
Montreal
that it's-
steak
it's
in
not
there?
that it's good for you. It's not bad.
It's not
for
bad.
You. It's not.
It's very
less of-
questionable
less of
on the
evils.
face.
Or you could just put zinc on and get the same result.
I tried to say the same thing, but I also was like, you know what?
It's
You do
fine.
you.
Yeah.
Yeah.
Beef tallow.
Yeah, okay. We kind of talked about lymphatic massage for face, but more the gua sha. What about mewing?
Like
When
snatching.
you do like the exercises?
Yeah.
I think
don't
it
know.
works. It
I can
works.
see it.
Yeah, it
It's a
helps.
Like
muscle.
almost facial exercises
it
with
helps.
your muscles, like
You
even those little jaw things people are using, like to
If you want like
strengthen
a huge masseters.
Yeah.
then
Yeah, see you later for your Botox.
For your
Square
Botox,
jaw.
It's not gonna like hurt you.
Yeah.
I mean, it does. Especially, okay, here's what I'll say.
And you look stupid in pictures
especially
when you do
for
it.
a male face where this bigonial angle is more important.
Yeah.
By all means, go ahead and strengthen your masseter. Fine. But for a female face, if you do that and then you come in and tell me I've been doing this,
Stop.
don't do that again.
Got it.
Yeah.
Threads.
Don't know enough.
I know
I'm gonna
that
say
this-
no.
Yeah, I know that that's a very controversial topic for a lot of people, and I know that there are a lot of
everyone I know I respect says no.
yeah, a lot of
Yeah.
providers that I do think do a great job that do them and enjoy them. They're short term fix. You're just redraping the tissue you have, which is what we're doing with filler and whatnot.
Yeah.
So fair. The scarring capacity that happens with them and the uneven wear that happens with them make me choose other things.
Yeah.
One side goes quicker than the other.
Well, and Dr. Seifert told me it makes future facelifts very difficult
that's
because
the
of
scarring.
the
Scarring,
tissue.
yeah.
What she said.
They're essentially a dissolvable suture with barbs at the end. Now, here's what I will say. The, I'm not sure what they're called, the soft, whatever, the soft threads that are just collagen producing.
Oh.
Sure, go for it. You can place those all through.
But then how much lift are you getting? Because they don't have like
They're not really meant for lift. They're essentially a biostimulator
Okay.
solid that just is laid in there like a Sculptra or Radius and just laid in
then
there.
just get Sculptra
Then
or Radius.
Yeah.
Agreed. But
You're
the
not
ones
lifting
that are
anything unless you
actually
have
barbed and
the
lifted
barb.
are
That's what I'm saying. Yeah.
a dissolvable suture with a barb on either end, and then you are going to get scarring from it. And I have personally seen when one side goes and the other doesn't, you look really lopsided.
Yeah. Oh, that doesn't sound
It's
good.
not a good look.
It's
Sounds like
Let's,
a no for me.
I have to say this, and I already know what you guys are going to say, but it's just too funny not to mention. Because it just was like in the last 2 weeks, the Kim Kardashian Skims jaw bra.
Yeah. I think she's a marketing genius. I think she's
Yeah,
really
for real.
good at what she does.
Yeah.
People are gonna buy it, but they probably don't need
Is
to.
it going to help?
no.
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 Yeah.
It's like
You know what,
Spanx.
though?
Take them off, it goes back.
Yeah.
I was saying,
Yes.
If-
And we put our patients
Yeah,
in
listen,
that.
In a
Based-
very cheaper looking version of
Based
that.
on the
Same-
look of it,
same
you need to be
context.
like 4 weeks out though, because
Yeah.
it's not very
It's
compressive.
not
It
super
isn't?
tight.
Okay. I
The
was
ones
gonna
that
order
we
one
give
and
you
I didn't think of it.
are a
so-
little more expensive
Yeah.
because they come with a surgery,
Yeah.
but they are much more compressive.
Yeah.
But
They're not
just
as-
to
they're
wear,
not as
grade.
cute.
yeah, just
They're
to
Not that
wear.
medical
hers
grade.
are cute, but it's like it looks very medical.
Yeah.
Ours.
Yeah.
do.
You like hair sticking out the top.
Yeah.
It's
And
crazy.
like, by the way, practicality.
I know. No, you're not
put
going
that
to see
shit on?
anybody. You're not going to see anybody.
Imagine
that
if
shit
Brent
on.
rolls over in the morning. And you
Yeah, I'm
got
like,
one of
hey,
those
honey,
on.
I'm coming to bed.
Honest to God, you go to freaking Walgreens, get an Ace wrap for
Literally.
$5. Like,
Yeah.
let's just, if you're really wanting to get after that,
Yeah.
I'm
Yeah.
just saying.
Coban?
I'm just actually mad I didn't market it myself.
I was gonna say, I think she also knows that it's kind of
Well,
BS.
that's what
but
Amy said.
People are
Like,
gonna buy
she
it.
just,
Yeah.
whatever she does,
She's a marketing genius. Well, she did the bra that had the nipples in it.
Mm-hmm.
Did you know
just,
that?
just get nipples.
They're just fake nipples in the bra.
You know what? We can give them to you for real.
Like, just don't wear a bra. I guess if your nipples don't point the right direction,
Well,
maybe
Carrie,
that's what the bra is for.
I'm gonna give you pushback.
That's
I know,
what the bra
she's
is
like,
for.
maybe that was
I
a
just had
really
an
good
epiphany.
investment.
Because for most people,
Yeah.
the nipples wouldn't show through
You
the
know what?
shirt.
Good
Yeah.
for you, Kim Kardashian. Good for you. She is a marketing genius.
The
It just
turnaround,
hit me who
yeah.
that bra was for. Okay.
Yeah.
That's how you know.
She's
we
like,
work in-
okay, she's ordered here right now.
There you go, Carrie.
All right. And then, okay, I feel like this is huge lately. I don't know why, but I have seen it so much. The pillow face. What causes that?
Over
much filler.
Yeah.
I know, but I feel like, okay, I have a
Or
question.
wrong placement
Yes,
of filler.
but can filler all place
Migration.
eventually cause that, even though you're not continuing to place it?
Yes.
Pick me.
So
pick
that
me.
where
yes.
it migrates.
Okay.
Like
So
that
the answer
worries
is
me a little
yes.
bit. So how do you prevent that?
All. Okay,
Wait,
sorry.
Adrian, no, I wanted to
Actually,
answer.
I know a lot about this topic, being an injector myself.
Yes.
No.
So, all filler migrates. All filler will migrate. Any filler that the best injector in the world places will migrate a little bit. We will do the best we can to put it in a plane where you are less likely to have that. We're not going to overfill you so you don't have that. The idea of pillow face can happen for a couple of different reasons. One, you're overfilled. Somebody didn't tell you no, which is the most powerful word ever. Somebody should tell you no. You don't need it. You don't need it. The other thing is, placement wise, we are inhibiting the movement of fluid out of your face.
Oh, that makes sense to me. Because that's what it looks like.
Not
that's
only
what it
with
looks
filler,
like.
but also with toxin. So
Yeah.
most people who are getting filler are also getting toxin. If you think about what we just discussed with gua sha, we're pushing fluid up and out through here.
Yeah.
But if we're filling through here and we're impeding all these lymph ducts, and then we're knocking out the muscles that are responsible for removing that fluid, what happens? You're going to get
Sits.
puffy.
Yeah.
We create contours that are not there, and then we continue to chase those contours. So now we've added all through here, and we look hollow through here. So we come in and we fill this, and then we come in and we fill this, and then we don't like this. And then what, over time, in very short time, a couple of years, now we're adding, and we're not assessing them in a dynamic movement where they're moving and talking. We're looking at them statically,
A still
and they're just
picture.
That happened
Fine.
to many people I know who you know.
yes. And the answer is
It's very obvious when you see it.
Yeah,
Get rid of
they
it.
went somewhere else and then they dissolved everything, and I'm like, and come back and see us, and it's crazy. That makes so much sense to me because when I look at those people, gosh, I never even thought about that. Like
Chasing
you
your
blocking-
tail.
But
It
you
is.
blocking, it's inflammatory.
But it's
it
just
looks inflammatory.
swollen,
and
yeah.
That's the best way to explain it. It's like swollen and weird, and it almost like you want to put a pin in them, and they're gonna go from all the
Literally.
Just like seriously though, like all the inflammation they've created because they aren't. It's even more reason to gua sha and like do that to like get crap moving
Yeah.
in your face.
the other thing to note with it is anything that we're placing in the face, no matter what, is everything we're doing is creating an inflammatory response.
Yeah.
We need to pick products that are creating less inflammatory response. So your injector can't pick the cheapest thing on the market.
Yeah.
That's the unfortunate reality of it. Like, if you're getting the cheapest option, you don't pay at the end of the day, you don't pay for your product. You pay for your injector.
Yeah.
And that's just the reality of it. Like, you can't take the cheapest product and the most inexperienced injector and get the result that you want. That's just not the way it works. Like, it doesn't happen like that.
Yeah.
So you have to pick the right product, the right injector, the right everything to not get that result.
Yeah.
And somebody should be able to walk you through all of that without feeling like it's sales. It should be a clinical recommendation.
Yeah. That's so interesting. What do we think about these Brandy Glanville parasites, and any take on that?
I don't know about
If
it.
she sat down in your chair, what would you say?
Well,
What's going on with her face?
I don't know about this.
Not to mention she just put
What?
nair all over it. And
No, I don't know about this.
What?
So,
I'm going to go ahead and throw the multifactorial out
Yeah.
there.
Okay.
Agreed.
Like, who the F knows what has been injected
true.
over how many years? No judgment, Brandy. But like, honestly.
Yeah.
And then now all of a sudden you're standing on a lymphatic plate and you're dissolving. Like, the whole thing is bananas to me.
180.
I do love my lymphatic plate though. I love it.
So I need to get one.
I'm not,
I'm gonna bring it in so you can try it.
that's fine.
What is it?
But my
But
lymphatic.
what I'm saying is that's
Just
not
the-
going to solve
that's
the,
not gonna solve the
the
problem.
parasite in her face, if that's what it is.
Correct.
Will it help with swelling? Sure.
Why does she have a
I-
parasite in her face?
I don't know.
It was never diagnosed.
I don't know if that's officially what it is.
that it
Look
was
it
a
up.
parasite.
Yeah,
I
it's
think
really sad.
At some
She's,
point, somebody
like,
had
deformed.
mentioned to her, a clinician had mentioned to her that it could be parasitic in nature,
Like a bacteria.
or she had an inflammatory reaction, or there are a million things that could happen.
Because you probably had how many
Yeah.
biostimulator
Yeah,
and
absolutely.
HA.
I think it's
you know,
very
like,
important
permanent.
in that circumstance to talk
Yeah.
about the fact that there is a true like body dysmorphia that happens even to people that don't think that that's happening to them, that they are seeing things that maybe your clinician does not see. That when you come in, the first thing we do is hand you a mirror and say, hey, what are we talking about? And you may point out things to me that I'm not seeing as a flaw or a fault. Like there are, I think that would perhaps was something that was maybe let too far go
Yeah.
at some point.
She hadn't been heard the word no
Yes.
Correct.
And
for
just
decades.
yeah.
And that led to, so she also, again, with social media, everybody's an expert, even if it's your own firsthand account, which doesn't always give us the truest information. So she's sharing her story, she's talking about what's happening to her, and not to negate anything because
No.
it's very real.
Yeah,
We're all
it's
seeing
very
it.
sad.
Yeah.
Very real,
Yeah.
very
I
sad.
would be devastated. Like,
But the reasoning behind it, like the what she's deciding is the reason for it happening may not actually be the truth. So sometimes we're seeking an answer to what is going on rather than listening, and we see that all the time.
Multifactorial.
Multifactorial. So, I don't know that she. If she
I don't
had
think anybody can comment on it, honestly, without.
It's difficult to say without actually assessing her, but just based on what she has shared of her own story, it makes me really concerned that she may also be seeing things that are more of a
Yeah.
say no more.
they're less clinical in nature.
Yeah. Say no more. Is there anything that you guys have seen trend-wise that you want to, or no, that people have come in and talked to you about that I haven't mentioned?
You know what I can say? Nasal Botox.
What's that?
What?
Nasal Botox?
Yeah. So I
I work there and I don't even know
I
what
was
that
like,
is.
there's no way that like 6 units can make that big of a difference. And I've done it on several patients, and they are like
For what reason?
nasal flaring, tip drops when you smile, with like animation. Yeah, elevating. You can do bunny lines up here. It's
Slim the entire nose
Yeah.
with little nasal
Yeah.
Botox.
Anything else that's fun we don't know about? Because I didn't even know about
I
that.
don't know. Let's do it.
What's your new, you were doing some new technique or something with filler the other day.
Oh, with lips. Yeah.
Yeah, we're so going into other practices and working with them with new techniques and product placement with Revance that I contract with. Most places I find backfill some of their syringes to do lip filler, and it involves a smaller needle and a smaller syringe, and it just isn't something that I've been typically doing. But I've seen wonderful results out of the injectors working all over. I've worked with some amazing injectors all over this side of the country. We came back the other day and I said, let's just try this. Let's just see how it works for what we're doing. And we found it to be really effective. So, but it really is great because it's another tool for us. There is no way out there, injection-wise, that we, at this point, have not done.
That's true. My lips, we did it yesterday.
Yesterday,
Nice.
and
Claire did it. Yeah.
Yeah, Claire.
Oh, if I did my lips,
I think you'd
Well,
be surprised.
normally that's what
yeah,
I would be. But
that was
that's
great
what,
before the
we're just
podcast
like,
to do that.
Let's do it.
Well, I think that's also part of the advancement of some of the products that we are using, because we do like to stay on the front edge of things. Is some of the anesthetics and the products are changing to products that provide less swelling, bruising overall too.
Interesting. I love it. How do we want to leave this? Any final food for thought?
Well, one, if you haven't seen Andy, you're missing out.
Agree.
If you're a current filler patient from a lip standpoint and you haven't seen Andy, you're missing out. If you don't come to the laser event,
You're financially
you're either
missing out.
Adrian or
financially
you're missing out.
honestly, there
You're
are
gonna age faster.
very little things throughout the year that we are able to offer you from
Yeah.
like a savings
It
standpoint.
is the biggest savings we offer.
That
It is the
1000%.
biggest
Hands
savings we
down.
offer. Like
We're
this
not the
is-
Grouponners.
We're
No.
just not. But
No.
this is something that we can do for you
Yeah.
that really makes a big difference,
Huge
both
difference.
pocketbook wise and face wise.
Agree.
Like,
And it's
1000%.
fun.
Yeah.
It's fun.
Also,
So-
can be like a really cool gift for
Yeah.
someone too.
Amazing.
Early Christmas.
this is
Yeah.
what your wife wants.
literally
A million.
She
I
doesn't want to
promise you.
This
vacuum.
is what your
True.
wife wants.
your mom wants it.
Yeah.
Your
Gift that keeps
girlfriend
on
might
giving.
want it.
Agree. Agree. Well, thank you guys for coming. Thank you, Getaway. It got really dark. I don't know how long we've been going at this, but cheers to the next
Candlelight.
one. And Stacey,
Mine's out.
you're empty. Okay,
I'm out.
Well, cheers. I'm almost. Look, I saved a sip.
I think there's some melted ice in there.
So cheers. Thanks for coming and come and see us. So we'll hopefully see all of you at the laser event.